Okay, we are moving on to Unit 10, which is fluid balance and the urinary system. Urinary anatomy has four main parts. We have two kidneys, we have two ureters going from the kidneys to the bladder. We have the bladder, we have the urethra, and the meatus is the actual hole where the urine comes out. I guess that's five parts if you count the meatus. Changes in the urinary system due to aging. The kidneys do not filter as efficiently. The bladder muscle tone weakens. Bladder holds less urine, so there's more frequent urination. Bladder may not empty completely, which is an increased risk of UTI. The longer it sits in the bladder, the more risk of bacteria forming. Disorders of the urinary tract system. Urinary tract infections are very common in the elderly. Causes are bacteria. Most common is E. coli. To prevent urinary tract infections, you can help by increasing the fluids and always cleaning front to back and reminding them to wipe front to back. Diseases of the urinary system, chronic renal failure. And when this happens, the kidneys are unable to function effectively. It can result from uncontrolled diabetes, uncontrolled hypertension, chronic urinary tract infections, nephritis, which is inflammation of the kidney, and some medicines. One medicine that is really hard on the kidneys that is your NSAIDs, like your Aleve and your ibuprofen. If those are taken too often, they are filtered to the kidney, so they can cause kidney damage. So you have to be careful with those. That's a picture of a hemodialysis machine. So what it does is, since your kidneys can't filter the blood, it takes the blood out, filters it, and then puts it back in. Kidney dialysis, like I said, if you have kidney failure, you have to go dialysis. Usually dialysis is 3 days a week, or at least minimum of 2. Urinary retention is also a problem in the elderly. Inability to adequately empty the bladder. Some of the causes from this would be surgery, obstruction, infection, or some disorders such as diabetes and multiple sclerosis. Catheters is a tube inserted. Any catheter is a tube inserted to drain fluid. It can be inserted through a body opening, but we're going to talk about urinary catheters. This is a picture of a straight cath. This is inserted to drain urine from the bladder and then removed after it's drained. So this is one that maybe you need a urine specimen. So you go in, you get urine, and then you take it right back out. It doesn't stay. And then this is an indwelling catheter. You can see the catheter, the bag you can't see, but it is inserted into the bladder through the urethra, and then once it's in the bladder, there's a balloon right there that they fill with water, with sterile water, and that's what holds it in place in the bladder. So that's what that looks like. When you're inserting a catheter, once you hit the bladder, you'll see urine start to come out, and that's when you know it's time to blow up the balloon, when you see the urine start to flow out through the bag. Emptying a catheter bag, this is something you guys will do at the end of every shift. The catheter bag is supposed to be emptied. You're going to place a paper towel on the floor, open the clamp to let the urine flow out into the graduate, and do not let the spout or the clamp touch the graduate. Obviously, you're wearing gloves when you do that. And then you're going to take it to the bathroom, look at how much output there is, and document it. Condom catheter, sometimes they're called Texas catheter. Urine drains through the condom, and the condom is placed over the penis. So you don't see those used a lot, but that is an option for males, obviously. Then the leg bag is for somebody who has indwelling catheter but is maybe not bedridden and wants to get out and about. The leg bag is just strapped to the leg like this. It is a smaller bag, so it needs to be changed more frequently. Fluid balance, taking in and eliminating equal amounts of fluid, is normal fluid intake. So if you take in 2,500 calories of fluid a day, then that's what you should be taking out too. And that's when we start talking about intake and output. Normal fluid intake is 1,500 to 2,000 in 24 hours. And so the intake is that, the output should match. Edema and swelling comes from fluid overload. Edema is swelling, same thing. More fluid enters the body than can be eliminated. It occurs when the heart, lungs, and kidneys are not working properly. Signs and symptoms of fluid overload would be weight gain. That's an important reason a lot of people are on daily weights, especially if they're in congestive heart failure. Kind of shows if their medicines are effective. Difficulty breathing, swelling feet, ankles, and hands, decreased urine output, and skin appears tight, smooth, or shiny. Dehydration would be the opposite of fluid overload, where you have a fluid deficit. The fluid output exceeds the fluid intake. Possible causes would be poor fluid intake. That's why at the nursing homes they have hydration cards, and we fill up their water pitchers and encourage them to drink unless they're on a fluid restriction daily. You can get dehydrated from vomiting and diarrhea as well. Signs and symptoms of dehydration would be thirst, sunken in eyes, dry mouth, and mucous membranes. Their urine should be dark. When you look in somebody's urine bag, it should be a light yellow. If it looks dark or amber, often that is a sign of dehydration. Cracked lips, weakness, low blood pressure, and an irregular heartbeat. Intake and output. Intake is all liquids taken by mouth, clear liquids and full liquids, and IV fluids and tube feedings. So during this, we're going to be talking more about intake and output, and that's one of your skills that you have to do. Output would be urine, liquid stool, vomit, any wound drainage, and perspiration you can't really count. So measuring I&O is an ongoing process. Measure and record all fluid taken in over an eliminated period of 24 hours. It is totaled for each shift and then added for a 24-hour total. Now, in the hospital setting, almost everybody is going to be on intake and output, so that's something you definitely have to be aware of. Nursing home, the only ones who are on intake and output is somebody who's on an IV or has a Foley catheter usually, or on a fluid restriction. Okay, basic things that you need to know. 1 ounce equals 30 millimeters. So when you were reporting I&O, you were reporting in milliliters. So you can't just, 8 ounces has to be, you're not going to give it in ounces, you're going to give it in milliliters. So 8 ounces would be 240. There's a conversion chart in your book on page 266, and then I also put it on here. So that is just a quick reference when you're looking to do the I&O worksheets. Intake and output. Fluid output is measured in a graduate, and there's a graduate right there. Graduates are containers that measure fluid in milliliters and may also measure ounces. Place a graduate on a flat surface and measure at eye level. So you are not supposed to hold it up and read it. You're supposed to set it down on something and get it eye level and read it. Empty the contents into the fluid and rinse out the graduate, and of course document the output. NPO means nothing by mouth. In Latin, it stands for nil, which is nothing per os, which is mouth. Nil per os, or nothing by mouth. If somebody is NPO, they have their water pitcher would be removed from their bedside. Restrict fluids. Fluid intake is limited to a daily level set by the physician. They don't have a water pitcher in their room either. Fluids given certain times of the day and a certain amount. For congestive heart failure or kidney failure. Forced fluids would be the opposite of fluid restriction. Offer fluids frequently Ask resident what fluids they prefer. Keep water pitcher and cup within resident's reach if able. Offer assistance. Specimen collection. If this is for somebody who's in isolation, you're going to have 2 labels, one label outside the room in a biohazard, and put on your PPE, take the specimen container and label into the room, place the label in the specimen container, remove gloves, pick up the specimen container with a clean paper towel, specimen container, put in a biohazard specimen, discard paper towel, seal the biohazard bag, take specimen to the proper site, wash hands. This is also on page 310 and 314 in your book. Handouts to review is the handout on bowel and bladder training and the handout on specimen collection. And then you will also have some assignments to do for intake and output this week for lab skills. That's all we have.